Hello and welcome to StormShannon.com once again. In this video we are taking the straight leg raise assessment video, which should be somewhere right above this, and we're now adding to it the exercises that we want to do to help strengthen the stabilizer muscles once we've done those muscle releases. So if you haven't watched that video or you haven't gone through the assessment and done the muscle releases, please watch that first. These exercises still will work, but they're not nearly as effective if you haven't done the muscle releases to begin with. So, kind of revisiting a little bit, in the first video we talked about doing the prone, the face down, then the supine or the face up straight leg raises, then the double straight leg raise, and then the sideline. So now we're going to go through each one of those based on those assessments and what we had to release, and we're going to talk about the exercises to accompany that. So the first one, the prone straight leg raise, we said that if you have pain or you have difficulty, decide that you have that, you want to release that calf and then possibly that inner thigh. So for the calf, the reason why releasing the calf reactivates the stabilizers is it actually turns your glutes back on. So your glutes are a powerful stabilizer for your pelvis. So if releasing the calf releases that tension and decreases your pain, we then need to fire those glutes. So what we're going to have you do is what's known as the single leg glute bridge. So what you're doing is if I'm doing my left side, I'm going to be bridging my hip up on that side. I want to bend my ankle straight up, so I'm driving through my heel, which causes a stronger activation of the glute. The other thing that causes a stronger activation is bringing my knee to my chest. And you're going to bridge up and back down. And you just want to go nice and slow, shooting for about 20 to 30 repetitions. So with that, that should get those glutes starting to fire again. It's key that if you find that only one side had to be released, just do that side. That's fine. If you found that both sides were released, you can do both sides, and you can actually alternate between the two, doing a bridge that's kind of like a march, to reactivate it, doing 20 to 30 on each side. If you also had to release the inner thighs, then we need to strengthen the outer or the glute med as well. And we'll actually get to that with the sideline straight leg raise. It's the same exercise for that, so we'll cover it when we get to that point. So now we're going to move on to the supine straight leg raise. For that one we found, if it was tight, we had to release the pec minor. So if the pec minor is overactive, we need to strengthen the opposing muscle group. And in this case, it's known as the lower trap. And what we want to combine with that is a strengthening of what's known as the multifidus. Because that tends to be the muscle that gets shut off by that pec minor that leads to the pain with that straight leg raise. So we're going to combine the two into one exercise known as the Bergdahl. So for the Bergdahls, we're on all fours. We're going to be reaching out opposite arm, opposite leg. In this case, though, we want to activate the lower trap at the same time. So we're going to do it very specifically. What I'm going to have you do is first you're going to reach out with your leg. Then to reach up with the arm, what I'm going to have you do is you're going to bring the arm up, but then I want you to focus on pulling the shoulder blade back and down, like you're trying to, in this case, my right shoulder blade, I'm trying to tuck it into my left hip pocket. So I'm going to bring it up, pull it back, and I'm going to come down. And I'm going to repeat that. So, and the key is the side of the straight leg raise that you had issues with, where actually that's the arm you're going to lift for the Bergdahls. So you're actually going to be lifting the opposite leg. So if that's too confusing, or you found that both were painful anyway, just work on both. It tends to be that the lower trap is weak on both sides for most people. It just tends to be one side's worse than the other. So in this case, you can go back and forth, bringing that, coming down, bringing the other side up, bringing that up, pulling that shoulder blade back, and coming down. Same thing as with the glute bridges, 20 to 30 repetitions, and that should get that reactivated. So, for the double straight leg raise, you had to release the hip flexor. So after you release the hip flexor, the exercise, same one we did for the calf, because what the hip flexor is shutting off is the glutes. So we need to strengthen those glutes back up. So once again, we're doing that single leg glute bridge with the ankle up, the opposite knee bent up, and we're going to be driving off the leg of the side you release the hip flexor on. So we see a lot of overlap. So we can narrow this down to just a few exercises that cover the whole spectrum of the major muscle groups that get shut off with this activity. Finally, for the last one, for the sideline leg raise, the weakness there, or the muscle group that gets turned off, is what's known as the glute medius. So to reactivate that, or if you recall, I said it's the same exercise as if you had to release the adductor group, the inner thigh, when we did the prone or the face down straight leg raise. You're going to do this exercise as well. It's the side-lying leg raise. We're actually going to do that as a strengthening exercise in this case. For this, you will need a little bit of equipment. All you're going to need is either a resistance band or a belt. What we're going to have you do is laying on your side, just like we did with the test, straight up and down, pushing that hip into extension, and we're going to do raises from here. Where the band or the belt comes in is I want you to use this to resist the hip extension. So in this position, I'm going to be trying to pull my leg back forward, push my leg back, and I'm going to raise from here. The reason for that is we released, the hip flexor, or in this case, if we're trying to shut off the adductor that we released, we want to fire the hip extensors that shuts both of those muscle groups off. So by resisting that hip extension, we force these muscles to fire harder, which shuts this off. And now when I raise this, it puts all the force right here for that glute med so I can strengthen it. Same thing as the other exercises. We're going to do 20 to 30 repetitions. Just one set is fine. You can build up and add a second, third set as it gets stronger, and that will help you out a lot. Overall, as this gets easy, you have to release a lot less. You can do a lot more repetitions strengthening wise. You want to take the next step in the exercises. With that, a lot of times the exercises that work really well for the next step are going to be compound exercises. I like to move people from this into a kettlebell routine or a yoga routine, whichever one suits you more. For the kettlebells, we want to do things like kettlebell swings, Turkish get-ups, maneuvers such as that to start strengthening those same areas. Last, I do want to say that if that sideline straight leg raise was weak, we do need to add a second exercise to that, primarily if we had weakness there. And it's a good exercise to add really to the whole mix if you found any weakness at all or if you're having any pain at all. That exercise, because it's hard to test this muscle group on yourself, we need to strengthen what's known as the quadratus lumborum. The quadratus lumborum is a large muscle group that helps to keep your pelvis level, and I find in many patients that anytime there's a disruption in any of these muscle groups, the QL almost always gets turned off. So we want to make it strong to help hold that pelvis level, to take that pressure off of not only the low back but the pelvis and the SI joints as well. So for that, we want to do side planks. And I know everybody hates the side plank. There's good reason for that. Almost everybody is weak through their quadratus lumborum, even into their abdominal groups. So the side plank is a great exercise for that. Works really well. It's also a good progression from the side lying leg raise, because we can add in a side plank with a leg raise, which activates that glute med even more. And now we're combining both of those muscle groups together, which is how they actually function when you walk and move, that your QL and your opposite glute med fire together. And that's exactly what we're doing with the side plank. So for the side plank, What we want you to do to start with is do it with your feet one behind the other, not stacked up. As you get better at it, and you want to make it more challenging, you can do it with them stacked up, and then you can do it with the leg raised. You want to keep your body in a straight line. You're going to post up on your elbow. You want your elbow directly under your shoulder so we don't cause any issues from this end. We're going to bridge that up, hold that there, and we can do it once again with one foot behind the other to start with. Hold for about 10 seconds and relax. Try to build yourself up to 20 to 30 at a time. Once that gets easy, stack the feet up, bridge from here. As that starts to get easier, raise the leg and hold that. Same thing, progressing to 20 to 30 repetitions at a time. That is a complete program to start strengthening those muscle groups. And remember, as that gets easier, you can start adding in the more advanced moves like the kettlebell exercises, or you can start adding more yoga poses and stuff into it. Works really, really well. With all of that, it all begins by resetting these stabilizer muscles. So even if you're wanting to do yoga, by all means go and try, start doing some yoga. Do this stuff before your yoga routine, before you run, before you lift weights, before you swim. These are all great exercises to reactivate, strengthen those stabilizers so you're good and stable before you do your other exercise programs. All right, well that's it for this video. Hope that helps. If you have any questions, please do add into the comments, and we'll make changes, make this better if we need to. That's it for now.